There we go. Hi, everybody. I am back from the dreaded ultrasound procedure, and I wanted to talk to you about it since I've gone through it now and let you know how it went. Sorry, I blocked the camera. Not intentional. Well, it's like your typical procedure. Lay down, feet in the stirrups, slide down to the end, blah, blah, blah. By the way, guys, you might not want to hear this. This is more for women. I probably put something like that on the chat screen, or not the chat screen, but the video screen before I post this or after I post it. So my husband was there to hold my hand the entire time. And at first he was like just gently touching my hand like I told him to do. And then I realized that pressure on my hand probably would distract me more. So I told him, squeeze my hand till I tell you to stop. So he squeezed it the entire time, with good reason. Vaginal ultrasounds, although not excruciatingly painful, are very extremely uncomfortable. And if anybody tells you that garbage about, oh, it's like having a mild cramp in your period, no, it's not. No, it's not. Because you're used to having those and you're used to being able to grab your stomach and fold over and curl up into a little ball. You can't do that when you're laying there with your feet in stirrups. You're laying there at the mercy of whoever's poking around inside of you, and it's not pleasant, let me tell you. Um, it's not as much cramping as it is pinching, like pinch burn, and extremely intense pinch burn that you want to end. It wasn't fun. I breathed through it because that's the most important thing to do is number one, relax. Don't panic. Relax. Think happy thoughts. Go to your happy place, whatever. And two, breathe. Remember those techniques you used when you were having babies or you've seen people use them? That's the time to use those. I did a lot of deep breathing before I even went into the procedure, and I deep breathed through the whole procedure. And I just remember laying there thinking, is it going to be as bad as the last one? Because the first one that I had, which would be the last one, I was holding my daughter's hand, and I probably was squeezing her fingers so tight they were turning blue because it was so agonizing. But that was when I had HPV, which I am HPV free now. Sorry, get tongue twister there. So it's not as painful, but it still was uncomfortable. Very, very highly intensely uncomfortable. 800 milligrams of ibuprofen were taken about a half an hour before the procedure. I think any other future procedures I have of any kind, the ibuprofen will probably be taken about an hour before, so it has a good chance to kick in strongly. You can't see it right now, but I'm laying on a heating pad because, yeah, I'm still kind of hurting. It's not bad, not as bad as being there having it done, but it's pretty owie. It's not fun. So anyway, the lady was super nice. Of course, they can't tell you anything about the results, so you have to wait. And that's sometimes the worst part of it is waiting to see if anything's going on that you need further treatment for. That's never fun. So that's pretty much what happened. Glad my husband was there. Would not have wanted to go through that alone. Oh, and I was biting my finger the whole time. Like this. I was biting my finger because it was so uncomfortable. And they tell you, oh, just tell me if it gets bad and I'll stop. Yeah, they got me in early. Hi, movie maker wannabe. Yay, I finally get to see somebody actually say hi in the room or in on the chat. I don't know what do you call these things? These live chat sessions, live broadcasts. But what do you call the chat thing? The live chat? Not sure. Anyway, I'm glad you said hi. I see somebody else is here. If you want to say hi too, that'd be great. Because I like to know I'm with somebody and not talking to myself all the time. It'd be nice if you could actually see people on these things, and kind of really interact. Hi, Akon Sona. Oh, I see that you left me thoughts and prayers. Thank you so much. I like your hat and your profile picture. Thanks for coming in. So anyway, that's how it went. I've definitely been through probably worse than that. And I'm just glad it's done, and now we just wait and see what happens and what they tell us. And I'm believing for no C word, no bad things going on down there, nothing alarming, nothing deadly. I'm believing for total, complete healing and health. And yeah, good report. That's what I'm believing for, a good report. I'm speaking that into the atmosphere and existence. I'm all about, I guess some people call it positive affirmation or the law of attraction. I call it faith, and I'm believing that all will be well. My husband's believing that for me and with me. So I will let you all know it, of course, what's going on with that. But anyhow, so that's the update. Here's one of my kitties. You could say hi to him. Sorry, honey, I didn't mean to bump your thing. There's our kitty. This is Teddy Bear Cat. Teddy Bear, say hi, Teddy. He's like, forget you. Anyhow, I'll keep you updated. That's all I have for now on this topic. I might be back on later if I feel better. I'm laying here on the heating pad, like I said, and just trying to have all my organs go back into where they want to be. Because honestly, having somebody stick something that looks like a curling iron in you that way and push things around was not a picnic. And yeah, my cervix and ovaries are pretty mad right now. They were happy where they were. They didn't appreciate being shifted in that way so abruptly just to take pictures. But I know it's a good procedure and it's something that I'm thankful we have because I was thinking in my car this morning, I was listening to Norval Hayes. He's one of my favorite teachers, Bible teachers. I was thinking, what about when, like back in Bible days, when they didn't have ultrasound and they didn't have biopsies and they didn't have all that stuff? People died. It was just like, okay, you're very, very sick. And the next thing you knew, so and so passed away, you know? So we got to be thankful. If we like our lives and we like living, we've got to be thankful we have the diagnostic stuff that we have right now. And I am very thankful. Oh no, I don't know, Acon Sona, if the results came out okay. I haven't found that out yet. That's what I was just saying. I have to wait and find that out. I'm believing they will come out okay. I am standing in faith, believing that that's the case. Uh, oh, really, movie maker wannabe? You've been having tests every 3 to 4 months, so I guess I shouldn't complain. Mine was because I had breakthrough bleeding after being in menopause already for 2 years. Oh no, that's okay, Akon. I get it. That's reasonable. If you just pop in and you don't know what the conversation is, that's definitely reasonable. But I appreciate your thoughts and prayers or well wishes or whatever you sent my way. I think all positive vibes and energies are good. It's better than negative ones, anyways. You know, when I first became a Christian years ago, I people would say, "Well, I'm sending well wishes your way," and I'd be like, "No, don't do that. Just send prayers. If you can't pray, then like I don't want anything you have to send." But the truth is, anything that's not positive is going to be negative, and I much would rather have somebody sending me positive stuff than negative. That's how I feel about that now. I don't know. Honestly, I think churches these days, kind of, as my mom used to say, cut their own nose off to spite their face. What weird sayings we had back then. Um, because they think everything that is not Bible or everything is not church is a bad thing, and you can't learn anything, you can't glean anything from it. And I don't agree with that. So, oh, a mammogram, movie maker. Yeah. I've had my share of those too. Those are always fun, but they're not as uncomfortable as this was. I guess there is a difference between agonizing pain and extremely strong discomfort. And today was just really extremely strong discomfort. I guess maybe a little teeny bit of pain, but not like it could have been. Not like it was the first time I had it done. It was like when you have an infection down there, which at the time, and this was like years ago, I had HPV, and which means my cervix was very badly infected, when you have an infection and someone's poking you, it sends like shock waves of extreme agony through you in a very bad place. But if you're not infected, which I was so happy to get the HPV result back. That's what you were thinking, Acon Sona. That was my HPV result that I had recently. I had the test done and it was clear. There was no HPV. So yes, I am glad that those results came back okay too. However, my doctor is still talking endometrial biopsy, which is why I want and am believing for a clean bill of health and a totally um, clear, normal endometrial lining from this test that I had done today. That's what I'm believing for. So we will know within the next day to 3 days. I may get the results back on my actual online doctor thing that I'm on. I have like they have a website for my hospital where you can go on and get results. So I might have them before then. Who knows? But then, of course, the doctor wants you to come in. They want to talk to you or they want to schedule you for something else, which they already got me scheduled with a gynecologist. I'm hoping it's just for a routine appointment. Um, no, they did not do freezing for the HPV. I did not have it that bad. I had CIN1. They caught it early, thank God, because I had had it for about, I'd say 6 months to a year. I had it like right when I left my husband, and then by the time right before I got divorced was when they said you're still showing abnormal cervical cells, and then they tested me for HPV and it was positive twice. So they did the first biopsy, and then a year later, I think they did another biopsy. And when they biopsy it, apparently they scoop out the bad cells. So after that, I was fine. I also, ladies, pay attention to this. Increase your folic acid. Folic acid apparently makes these HPV cells, what's the word? They're impervious to it. They can't penetrate the cervix or something. I don't know exactly how it works, but I had gone online and I was terrified about the biopsy. So I started doing a lot of research and found out that if you take your folic acid, like large doses of it, not too large, but reasonable, then you won't have HPV again, most likely, unless you have it like really bad and have had it for years, maybe. I don't know. But for me, it worked. I started taking it. I still take folic acid. I take a multivitamin with folic acid and I take separate folic acid. So some people say folic acid, but I say folic. It doesn't matter, whatever. Um, so no, I did not have any cauterization of my cervix or anything like that. I didn't have the thing where they cut it out. Thank God. I didn't have my cervix removed. Very, very grateful of that. I've heard about that. They really need to put women to sleep for these procedures, but they don't. And then they'll say, well, we can give you something to sedate you. We'll give you some twilight sleep. That stuff is a flipping joke, okay? I had twilight sleep to have a stent removed from my kidneys. You feel it. It may not hurt, but it's like such an icky, odd feeling. You want to freaking climb out of your body. It's awful. So, unfortunately, insurances only pay for what they pay for. And I'm on like Medicaid type insurance. So, I get what I get. So, I'm just trying to stay healthy. That's why I'm trying to eat so healthy. And I'm cutting a lot of things out of my diet, like no red meat, very, very little to no sugar, if I can at all help it. Um, about the only thing that I've been eating with sugar in it is chips, like cookie chips. And I got to stop that too. I got to find some sugar-free chips if I'm going to be munching on chocolate chips. But yeah, just take care of yourself because you don't want to have to go through all these yucky procedures and stuff. It's scary, it's upsetting, it's concerning, and if you can prevent it, all the better. That's what my method of healing is. Keep it from happening to begin with, then you don't have to treat it, right? Okay, well, anyway, I'm going to go get some rest and lay on this heating pad some more and probably chill. If you want to chat with me, just look me up on Facebook. Uh, I'd love to talk to everybody. Oh, yeah, I hear you, movie maker. A small surgical procedure in the office and felt the icky feeling too. Yeah. Yeah, it's not fun, that's for sure. Anyway, I just wanted to check back in, let y'all know how it all went, and I'm gonna get off of here for now and maybe catch up later on my New Testament reading or something online. So be looking for me then. God bless everybody. See you soon. Bye. All right. Good morning. I know he's such a good kitty. He doesn't mean